The simplest one, for which there are excellent data, is that exposure of your body up to the neck to cold water, and it doesn't have to be super cold, by the way, to cold water has been shown to increase baseline levels of dopamine and the other so-called catecholamines, which include norepinephrine and epinephrine. But for sake of today's discussion, dopamine in particular, for not just 1, but at least 2 and probably as long as 4 or 5 hours. There have been some additional scientific studies after the paper I just mentioned, and it's really remarkable. You can accomplish this a number of different ways. You could get into a cold shower in the morning, and I do recommend doing this in the morning. And in that case, it's okay to get the water on your head. In fact, I recommend it. You could get into an ice bath. You could get into a cold plunge. In these circumstances, I'm not suggesting this for sake of increasing metabolism or fat loss. The whole discussion around deliberate cold and metabolism and fat loss has become a little bit controversial, so we won't go there now, mostly because we're focused on the clear ability of deliberate cold exposure to increase dopamine for long periods of time, aka your dopamine baseline. The ways to do this vary depending on the temperature. So for instance, there are data pointing to the fact that if you want to get a long-lasting increase in your baseline dopamine, you could take a very cold shower or cold plunge or ice bath for a very brief period of time, anywhere from 30 seconds to 2 minutes, maybe 3 minutes, but probably 30 seconds to 2 minutes. Now, you might ask, what is very cold? Here I have to be careful because I don't want to recommend anything that's going to cause anyone to have a heart attack or go into shock or anything of that sort. It's going to vary by person depending on your level of cold tolerance. So what I recommend is if you are going for the short exposure, long dopamine release approach, that is 30 seconds to 2 minutes, that you start warmer than you think you need to, and then you ease into it over a few days. But we're really talking about ranges in temperature from anywhere from about 37 degrees Fahrenheit to about 55 degrees Fahrenheit. Again, be careful, approach it with caution, and ease into it. I do recommend doing this early in the day, and I should mention not after strength or hypertrophy training, because within the 6 hours after strength or hypertrophy training, this deliberate cold exposure, especially immersion up to the neck, can suppress the strength and hypertrophy adaptation that the training is designed to accomplish. Okay, so that's one approach. The other approach that's supported by the literature to increase baseline levels of dopamine for very long periods of time, in fact, this is the original approach, is to get into warmer water, so not warm, but warmer, so 60 degree Fahrenheit water, up to the neck, and to stay there for about 45 to 60 minutes. The reason I don't think most people will do that, or that most people would prefer a shorter, colder exposure protocol, is that most people don't have 45 to 60 minutes each morning to get into water and sit there. And in that study, they actually had them sitting in lawn chairs, basically, in the shallow end of a pool up to their neck for a full 60 minutes and then measuring dopamine release and so forth. So there are a bunch of different ways to do this. I should emphasize, I don't think you need to be super precise about the temperature and even the duration. What I recommend is find a temperature that's uncomfortably cold to you, meaning that you feel agitated and you want to get out, but that you're confident you can safely stay in. And again, I can't give a simple prescriptive to everybody, but this is known to increase baseline levels of dopamine significantly. In fact, double them or more for long periods of time, meaning hours, up to 4, maybe even 6 hours into the day, which is one of the reasons I suggest doing this early in the day. I happen to get into a cold plunge or take a cold shower first thing in the morning. I do go outside and get my sunlight first sometimes. Sometimes I do the cold first. It really depends on my circumstances and how I'm feeling that day. I don't think it really matters which one you do first, but you want to try and get both of those in early in the day because you really want the catecholamines and cortisol elevated early in the day. Okay, so that's deliberate cold exposure. We already talked about exercise. So if you're doing your exercise early in the day, there's no reason why it couldn't be done in concert with this deliberate cold exposure. I recommend doing the deliberate cold exposure first for the reasons we talked about a few minutes ago. And then, of course, there are compounds, both prescription and over-the-counter compounds, that can indeed raise your baseline levels of dopamine for an hour or more. And when I say an hour or more, it really depends on individual variation in terms of how quickly you metabolize dopamine. And it depends on individual variation in how you manage or tolerate different dosages of drugs and different types of drugs. So the typical drugs, and here I'm talking about legal prescription drugs for increasing dopamine, are things like Ritalin, Adderall. Modafinil and armodafinil also tap into this system. And I did an entire episode about ADHD, which is the typical context in which you hear about these prescription drugs. But assuming it's prescribed by a doctor for either clinical reasons like ADHD or for other reasons, all of those compounds do significantly increase baseline levels of dopamine for many, many hours. That's absolutely clear, and it's one of the major reasons why those drugs are so effective in increasing motivation and attention. Then there are compounds that are sold over the counter, things like amino acids, such as L-tyrosine itself. That's a very commonly sold and used amino acid.